You crawl into bed exhausted, pull up the covers, and close your eyes. Finally, time to rest. But then it starts. A deep nagging ache spreads through your knee. It's not stabbing or sharp, it's something worse. A constant, grinding discomfort that makes every position feel wrong. You straighten your leg, nothing. You bend it slightly, still uncomfortable. You flip to your other side, adjust your pillow under your knee. Try lying on your back. Nothing brings relief. The ache just sits there, relentless and exhausting. What makes this so maddening is that your knee felt okay earlier. You went about your day, did your errands, maybe even took a walk. Sure, you felt a little stiffness, but nothing terrible. Yet now, when your body desperately needs sleep, your knee decides to scream for attention. The pain grows stronger the longer you lie there. Stiffness creeps in like your joint is slowly turning to stone. Every tiny shift triggers that horrible grinding feeling deep inside. If this sounds familiar, you're far from alone. Millions of people over 60 lose hours of sleep every week to nighttime knee pain. Night after night, the cycle repeats. You're bone-tired, your body is begging for rest, but your knees simply won't let you have it. I'm Dr. Emily Carter, and today I'm revealing why your knees hurt more at night than during the day, the hidden mistake you're making every evening that makes it worse, and a simple 2-minute routine that could help you sleep more comfortably starting tonight. Before we go further, remember this is educational information, not medical advice. If you have persistent or worsening knee pain, always consult with your healthcare provider. Now let's uncover what's really going on inside your knee when darkness falls and why nighttime changes everything. Here's something most people don't realize. Your knees depend on movement to stay comfortable. Every time you take a step, stand up from a chair, or walk across a room during the day, something important happens inside your knee joint. That movement acts like a pump, pushing synovial fluid throughout the joint space. This fluid is your knee's natural lubricant, like oil keeping an engine running smoothly. It coats the cartilage, prevents bone from grinding against bone, and keeps everything gliding properly. Each step you take actively circulates this precious fluid where it needs to go. But here's the problem. The moment you lie down for the night and stop moving, that pumping mechanism shuts off completely. You're lying still for 6, 7, 8 hours straight. During all that time, the synovial fluid stops circulating. Instead of flowing freely, it becomes stagnant, pooling in some areas while leaving other parts inadequately lubricated. Meanwhile, any inflammation that accumulated during your daily activities gets trapped inside the joint with nowhere to escape. The tissues surrounding your knee, all those ligaments, tendons, and the joint capsule itself begin contracting and tightening as they settle into one fixed position for hours. Your muscles fully relax, which sounds pleasant until you realize this means your knee loses the muscular support that normally stabilizes it. All of this creates a perfect storm for pain, and it's all happening while you're trying desperately to sleep. For someone in their 30s or 40s, joints can weather this nightly stillness without much trouble. Their cartilage is thick and resilient. Their synovial fluid is abundant. Their joint structures remain flexible. But after 60, the entire landscape changes. Cartilage naturally wears thinner after decades of use. The joint capsule becomes rigid and unforgiving. Supporting muscles gradually weaken, if not consistently strengthened. When you combine these age-related changes with hours of nighttime immobility, you get pain that's genuinely worse at night than anything you felt all day. This isn't random misfortune. It's a predictable cascade that affects countless seniors, but understanding it means you can finally interrupt the pattern. Now let me tell you about the hidden factor that almost no one discusses, and this is crucial to understanding why the solution I'm about to share works so effectively. Most people over 60 climb into bed with knees that are cooler than they should be. Not ice cold, not painfully cold, but several degrees below optimal body temperature. And temperature makes an enormous difference in how your joints function and how much they hurt. When your knee is cool, everything inside stiffens at an accelerated rate. The joint capsule, that connective tissue sleeve surrounding your entire knee, loses its natural flexibility when exposed to cold. The cartilage surfaces become less slippery and more prone to friction. Here's what your body does automatically. When you feel cold, your system immediately conserves heat by reducing blood flow to your arms and legs, including your knees. It's a survival mechanism. Your body prioritizes keeping your vital organs warm, so it restricts circulation to peripheral areas. Reduced blood flow creates a domino effect of problems. Less oxygen reaches the tissues that desperately need it for overnight repair. Fewer nutrients arrive to support the healing processes that should happen during sleep. Inflammatory waste products don't get flushed away as efficiently as they should. Most critically, that synovial fluid becomes thick and sluggish, almost gel-like, instead of flowing smoothly to lubricate your joint surfaces. It's like the difference between pouring cold honey versus warm honey. Cold synovial fluid simply doesn't do its job effectively. But temperature affects something else that directly controls your pain level. Throughout your knee joint, pain-sensing nerves are constantly monitoring conditions and reporting back to your brain. When your joint is cold and immobile, these nerves become hypersensitive. Their threshold for sending alarm signals drops dramatically. Pressure that wouldn't register as painful during the day suddenly feels intense at night. Minor inflammation that you barely noticed before now sends urgent distress signals. These sensitized nerves flood your brain with pain messages even though the actual condition of your knee hasn't changed at all. This explains the mystery. Your knee that felt manageable or even decent during the day can feel absolutely miserable at night, not because it suddenly deteriorated, but because the environment, cold, motionless, poorly circulated, has transformed how your nervous system interprets what's happening in that joint. So let's put the complete picture together. You go to bed with knees that are cooler than ideal. Blood circulation naturally decreases as you prepare for sleep. Synovial fluid stops moving and becomes stagnant. Joint tissues progressively stiffen in response to cold and immobility. Pain nerves become hypersensitive and overreactive. The result? You lie there awake, constantly repositioning, wondering why something that should be restful has turned into nightly torture. But here's where things get better, because there's a remarkably simple solution. The solution is this, and I need you to take this seriously, despite how basic it sounds. Apply gentle warmth to your knee for just 1 to 2 minutes immediately before getting into bed. Not earlier in the evening while you're watching television. Not randomly during the day. Right before you lie down to sleep. This precisely timed warmth creates a dramatic shift in how your knee behaves throughout the night. You have multiple practical options. You can wet a clean towel with comfortably warm water, wring out the excess, and drape it over your knee for 2 minutes while sitting on your bed's edge. You can use a heating pad, either microwavable or electric, set to low and applied for the same brief period. Or you can make this even simpler by ending your evening routine with a warm shower, directing the water over both knees for a full minute before toweling off and heading straight to bed. The method itself matters less than 2 factors: timing and consistency. It must happen right before bed, and it must become a nightly ritual, not an occasional experiment. Let me explain precisely what this brief warmth does inside your knee, and why such a simple action produces such noticeable results. Gentle heat immediately relaxes contracted tissues around your joint. Those ligaments and tendons that were beginning to tighten and restrict movement, they soften and release their grip. Heat causes the small blood vessels in and around your knee to gently dilate, dramatically improving circulation to the entire area. This surge of fresh, oxygen-rich blood flowing into your joint brings nutrients that fuel tissue repair throughout the night. Simultaneously, it helps transport inflammatory waste products out of the joint space where they've been accumulating all day. Here's the most important mechanism. Heat activates and thins your synovial fluid. When warmed, this fluid transforms from thick and sluggish to smooth and effective. It can now properly lubricate the cartilage surfaces instead of barely coating them. Imagine the difference between spreading cold butter versus softened butter. That's what you're doing for your joint fluid. When you settle into bed with a warm, relaxed knee rather than a cold, tense one, you're fundamentally changing what happens over the next 8 hours. You're enabling recovery instead of creating strain. Here's why this matters so much specifically for people over 60. Your body attempts most of its repair work during sleep. Growth hormones release, tissues rebuild, inflammation should naturally decrease. But these healing processes only work effectively when your joint isn't locked in tension, deprived of adequate blood flow, and broadcasting pain signals all night. Warmth unlocks that tension and allows your body's natural repair mechanisms to function as designed. This approach is particularly powerful after 60 because aging transforms joints in specific ways. The tissues surrounding your knee lose elasticity and don't recover their shape easily. Cartilage thins progressively due to decades of wear and tear. The joint capsule becomes notably stiffer and far less tolerant of prolonged stillness. These changes mean your knee cannot adapt to immobility the way it could in earlier decades. At age 35, your knee could remain motionless for 8 hours and you'd wake up fine, maybe slightly stiff for a few seconds. But now? Supporting muscles weaken overnight because they've lost baseline strength. The joint capsule tightens rapidly because it's lost flexibility. Synovial fluid circulates poorly because there's less volume and it's naturally thicker. By morning, your knee needs several minutes just to remember how to function normally. You hobble to the bathroom, waiting for things to loosen up, accepting this as inevitable aging. But it doesn't have to be this way. Pre-bedtime warmth directly counteracts these age-related changes. By warming your knee right before sleep, you're helping it enter the night prepared and relaxed instead of vulnerable and tense. Tissues remain pliable. Fluid flows properly. Blood delivers what the joint needs. Your knee gets its best possible chance to genuinely rest and recover rather than stiffen and ache for 8 hours. This is exactly why such a basic habit can create noticeable improvement within days. So what should you realistically expect after 1 week of consistent practice? Let me describe what people commonly report, because I hear these stories constantly from viewers who try this. The most immediate difference shows up the moment you stand up in the morning. That heavy, locked sensation is significantly reduced. Your knee doesn't feel like it was clamped in a vise all night. The stiffness remains for some people, that's normal, but the duration shrinks dramatically, perhaps 30 seconds instead of several minutes. Your initial steps feel natural and fluid rather than painful and mechanical. That awful grinding, catching feeling when you first bend your knee becomes much less pronounced. You're not limping across the bedroom, waiting for your joint to wake up. Movement returns quickly and feels almost normal. Many people notice their knees no longer crack and pop constantly during morning movement. Those sounds come from inadequately lubricated joint surfaces scraping together. Better overnight lubrication means less friction and less noise. Here's what you need to understand about cumulative effects. This isn't about one pleasant morning followed by returning to baseline. When you support your knee nightly with warmth, benefits compound progressively. Your joint receives higher quality rest. Tissues recover more completely because they're not fighting stiffness and poor circulation. Inflammation doesn't accumulate as severely because it's being efficiently cleared. Your overall knee comfort improves not just at night, but throughout your entire day. You might discover you can walk farther, navigate stairs more confidently, or simply move through daily activities without constantly thinking about your knees. Let me be absolutely clear about something important. Nighttime knee pain is your body communicating vital information. It's telling you the joint isn't recovering properly during rest. It's signaling that tissues are too stiff, circulation is too restricted, and inflammation isn't being cleared as it should be. These messages are easy to dismiss or accept as normal aging, but they're actually significant. Small nightly habits profoundly influence how effectively your joints recover, and that recovery determines whether you wake up stiff and miserable or comfortable and ready to move. Before we finish, I genuinely want to hear from you in the comments. Do you struggle with knee pain at night that disrupts your sleep? What does it feel like? I read every single comment, and your experiences help me create content that truly addresses what seniors are dealing with. And if you're finding this helpful, please subscribe to Dr. Emily Carter for more practical, evidence-based guidance on staying strong and mobile after 60. Here's your action step for tonight. Before climbing into bed, try the warm knee technique. Just 1 to 2 minutes of gentle warmth using whichever method fits your routine best. Commit to doing this consistently for 7 full nights and genuinely pay attention to how your mornings feel. Notice whether your knee feels less stiff upon waking. Notice whether the ache has decreased. Notice whether you're moving more easily without that initial painful hesitation. This isn't a miracle cure for arthritis or severe knee damage. Let me be completely transparent about that. But it may meaningfully support your joint's natural recovery process in ways that give you noticeably better comfort and improved sleep quality. Sometimes the simplest solutions work best precisely because they align with your body's natural functioning rather than fighting against it. Until next time, take care of your joints. Pay attention to what your body is telling you. And remember that small, consistent actions create big improvements in how you feel every single day. Thanks for watching, and here's to peaceful sleep and healthier knees.